Welcome to Learn Medical Spanish. Today I'll cover a review of systems for a patient with abdominal pain. So the patient presents, you've already done your HPI, and now you're going to go on to some additional questions that you could ask to just get a little more detailed. So as I've mentioned previously, this is similar to some content in a CME course that I helped create about medical Spanish for the emergency room, for emergency room clinicians. So I'll put a link to that in the show notes as well as the video description if you want to learn more about that. So getting into the actual phrases and everything. So as usual, I'll say the phrases in English first, and then I'll give you a chance to think of the translation, and then I'll show you the phrase in Spanish if you're on YouTube, or I'll say it if you're on the podcast. And then I'll repeat it 2 times total so that you can get a chance to repeat it after me a couple times and get some extra practice. So here's the first phrase. Do you also have? So think about how to say that in Spanish. También tiene. También tiene. So as you may have imagined, this is introducing several phrases that follow, because we'll ask, do you also have this symptom or that symptom or whatever symptom? Next, vomiting, vómitos, vómitos, nausea, nausea, nausea. So both of those look pretty similar in English and Spanish. Nausea is actually spelled exactly the same, but a lot of times it just comes down to knowing how to pronounce the words. And I did a very recent episode about pronunciation in Spanish. So if you're still struggling with Spanish pronunciation, go back and check out that episode. Next phrase, heartburn. Acidez, acidez. As you can probably tell, that means something like acidity, but that's kind of how they say heartburn in Spanish. Next, chest pain or pressure. Dolor o presión en el pecho. Dolor o presión en el pecho. So of course that's for all those people that show up with upper abdominal pain, especially if they're older and you want to kind of figure out if it also extends into the chest area at all. Next, diarrhea. Diarrhea, diarrhea. Watery, as in, is the diarrhea watery? Como agua, como agua. That literally means like water. Next, with blood, as in, is the diarrhea with blood or does it have blood? Con sangre, con sangre. Dysuria, and this is going to mean like burning when you urinate. That's the translation. Ardor cuando orina. Ardor cuando orina. Hematuria, and this will be, again, layman's terminology, so like blood in the urine. Sangre en la orina. Sangre en la orina. Vaginal bleeding. Sangrado vaginal. sangrado vaginal, discharge, as in vaginal discharge, flujo, flujo. So flujo means discharge, and in this case they know it's vaginal discharge from the context if you say vaginal bleeding, discharge, but if not you could say flujo vaginal or flujo de la vagina, just like you could say sangrado vaginal or sangrado de la vagina. There are almost always various ways to phrase things just like there are in English. Next, fever. Fiebre, fiebre, chills, escalofríos, escalofríos. Are you constipated? Está estreñido. Está estreñido. I know some of these words are kind of a mouthful, so if you're just listening and you want to see the text, there will be a link to the vocab list on my website, as well as a link to the YouTube version, and either one of those, you can go to either one of those and see the text if you would like. Next phrase, are you still pooping? ¿Está haciendo popó todavía? ¿Está haciendo popó todavía? And like a lot of things, you could probably shorten that. Come to think of it, you could probably just say ¿hace popó todavía? As in, do you still poop? But it's just another way to kind of phrase it. When was the last time? Meaning the last time they pooped. ¿Cuándo fue la última vez? ¿Cuándo fue la última vez? Is there blood? ¿Hay sangre? ¿Hay sangre? And that was referring to in their feces or poop, the blood there. Do you still pass gas? ¿Todavía expulsa gases? ¿Todavía expulsa gases? So if that wasn't totally clear, you could say gases intestinales, but they'd probably get it from that first phrase. And there is another way to say, like farting, you know the word farting in English, it's tirarse pedos. So you could say todavía se tira pedos, like do you still fart? But just like English, that's a little bit, very informal, kind of slangy, and some people might think it's slightly vulgar. So similar in Spanish with that phrase. So, but if you wanted to say it that way, that would be an option. Next phrase, are you eating? ¿Está comiendo? ¿Está comiendo? Did you eat today? ¿Comió hoy? ¿Comió hoy? What time? ¿A qué hora? ¿A qué hora? Okay, that was the last phrase, and I have a bunch of other dialogues and things on YouTube. So if you're on YouTube, you can see that playlist right there on the screen. And also, I have a video about my CME course if you're on YouTube. And if not, like I said, there's a link in your podcast episode description or show notes. So thanks for listening, and I'll see you next time on Learn Medical Spanish.